Continuing on with discussing neurologic emergencies, seizures. Seizure is some sort of neurological episode that's caused by a surge in electrical activity in the brain. It can take the form of like a convulsion, uh, characterized by generalized uncoordinated muscle activity, or it can just be a temporary alteration in consciousness. It's estimated that 2 to 3 million people have epilepsy, which is a common cause of seizures. Seizures can fall into two basic groups: generalized and partial, also known as focal seizures. So, generalized are kind of what people really think about when they think seizure. It's the tonic-clonic true shaking that occurs when a person has a seizure. Um, it's typically characterized by unconsciousness and then severe twitching of all muscles, and it can last um, several minutes, can sometimes be longer. It usually involves both hemispheres of the brain because it does take large areas for this to happen. In other cases, there may just be a brief lapse of consciousness and the patient's kind of like lights on, but nobody's home. These are called absent seizures uh, or petit mal because there's no motor activity, no actual shaking and jerking that the patient experiences. There are partial or focal seizures as well. This begins in one part of the brain and then can be classified again as either simple or complex. Simple partial seizures, there's really no change in level of consciousness. The patient may just have numbness, weakness, dizziness, visual changes, unusual smells or taste. Um, you may have some brief twitching or paralysis, but it's not full body like the generalized seizure. You could also have a complex partial seizure. You have an altered mental status or that just don't interact normally with your surroundings, results from abnormal discharges in the temporal lobe of the brain. So this is characterized by like lip smacking, blinking, isolated jerking. Patients may also experience unexpected or unpleasant smells or hallucinations. They may end up repeating some sort of physical behavior over and over and over. Some patients get what's called an aura, and we talked about this a little bit with headache as well. Um, they can see like flashing lights or blind spots that suddenly appear in their field of vision, or hallucinations. So, experiencing things that are not actually present. And it's not just seeing hallucinations, but they can hear or smell things that really aren't there. We've already talked about generalized. Status epilepticus. So this is during a seizure that lasts more than 5 minutes without the patient um, gaining consciousness in between. They just continue to happen every few minutes, and the patient never gets back to their baseline. Or when a seizure lasts longer than 30 minutes, that's also referred to as status epilepticus. Different causes of seizures. It can be congenital, and you can have some sort of form such as epilepsy, high fevers, um, structural problems within the brain, metabolic or chemical problems within the body, or some people, they just have idiopathic seizures. Nobody really can pinpoint the cause of their seizures. Most seizures tend to be epileptic in nature, and they can be controlled with medications. Just some of those uh, general medications that you may hear associated with seizures: Keppra, Dilantin, phenobarbital, tegretol, Depakote, Topamax, and Klonopin. So if you hear one of those, they can be used also to treat headaches, atypical type headaches, migraines, but their first indicated use is for seizure disorders. Seizures can also be caused by structural changes in the brain, such as a benign or cancerous tumor, an infection, or scar tissue from some type of injury that you've had previously. Metabolic causes, if you have abnormal levels of certain blood chemicals, hypoglycemia, so not having enough sugar in your blood, poisons, drug overdoses, a sudden withdrawal if you routinely utilize heavy alcohol or some medications, particularly sedatives. And then some prescribed medications actually have a side effect of seizures. Seizures, particularly in children, can result from a sudden high fever. It's not necessarily how high the fever goes, it's how quickly it rises to that level. So just because a kid has a fever of 103, 104, that doesn't mean that they're necessarily going to have a febrile seizure. It's when that temperature change occurs very, very quickly. That's when we're more likely to see febrile seizures. It is possible with febrile seizures that a second seizure may occur. So we typically like to transport kids that have febrile seizures for temperature control, body temperature control, and to try and reduce that fever. The importance of recognizing seizures, you need to be able to recognize when it's actually occurring, and then whether this is like their previous seizures if they have a history of it. Your patient may end up turning cyanotic from lack of oxygen. Seizures themselves may prevent the patient from breathing normally. If the patient is experiencing a blood glucose problem, you can actually help treat that to prevent the progression of seizures. But you also should be looking for other problems that could be associated with the seizure. Oftentimes, patients that experience a seizure fall and may have experienced an injury. Patients that have a generalized seizure oftentimes experience incontinence, so they end up peeing their pants. That's sometimes a way to rule in or out a seizure. Just because they aren't incontinent doesn't mean they didn't have a seizure, but if there's a sudden loss of consciousness and they become incontinent, it's very likely that that's associated with a seizure. The postictal state is right after that seizure has stopped. The muscles relax, becoming almost flaccid, so really, really loose and floppy. Breathing becomes labored, fast, and deep as the body's trying to compensate for that period of time where they did not have a normal respiratory pattern. The body, because you're not breathing for that short period of time, also starts building up acid in the bloodstream. Remember, CO2 is synonymous with acid when we're talking about bodily functions. So you start breathing faster to try and blow off some of that extra CO2 that's built up. Normal circulation and liver function begins to stabilize within a few minutes, and they start to breathe more normally. Sometimes that postictal state may have other signs and symptoms such as hemiparesis or weakness on one side of the body. It does kind of resemble a stroke when it does that, so definitely need to do some more investigating to determine if a seizure could be causing those stroke-like symptoms. Most commonly, a patient that's in that postictal state They're just kind of out of it. They're pretty tired. Lights are on, nobody's home. They're not really connecting well with the environment around them. Oftentimes, they're pretty confused. Um, Even if they have a history of seizures, they have a hard time thinking clearly, especially in those first couple of minutes. They may end up becoming combative with you, kind of if people just showed up and started getting up in your face and you didn't know why they were there, you would get combative too. So what they remember is what they were doing and not sometimes immediately right before the seizure. And now all of a sudden there's people up in their face. Like that can be pretty overwhelming sometimes. So make sure that you give them a little bit of space, continue to be calm and reassuring, talking them through what had just happened. If they don't improve relatively quickly, um, you should be thinking of other issues. What if they have an infection and they're going septic? Or you should be checking the blood sugar for anybody that's not kind of coming around, because it could be more hypoglycemia more than anything else. Syncope, um, you can have a misdiagnosis of syncope rather than seizures, or truthfully, vice versa. Some people, when they are faced with um, something overwhelming sight, such as blood, or they get really bad news, they may have that fainting reaction. And then as they go down, they kind of do this little funky chicken dance. And so people are like, oh my gosh, they had a seizure, they had a seizure. But there's really no true cause or signs and symptoms of a seizure. Sometimes, though, people that have a fainting spell and they don't do that huge jerk, some people might mistake that for just a syncopal episode and not a true seizure. Fainting typically occurs when the patient is standing or moving from a seated to a standing position. Seizures can occur really at any time in any position. Fainting is not associated with a postictal state. Seizures are. And that postictal state kind of varies from person to person. We can't say it only lasts for a certain amount of time because it really depends. Aside from stroke and seizure, the most common neurologic emergency that you'll encounter is just a patient that is not acting right, not acting like themselves. They're not thinking clearly, or they're incapable of being aroused to an alert state. In some patients, they may be fully unconscious. Some may be alert, but they just are completely confused. Causes: hypoglycemia, hypoxemia, intoxication, delirium, drug overdose, an unrecognized head injury, brain infection, body temperature abnormalities, brain tumors, and then overdoses or poisoning of non-medication type sources. And we'll go ahead and go into all of these in a little bit more detail in the next recording.